When a frozen rubber puck is traveling at over 120 miles an hour, it can impact the body with forces of over 1,000 pounds. So it's no wonder that things like what happened to Vince Dunn can occur in an ice hockey game where a player takes a puck to the face and can have pretty serious injuries. Welcome back, everybody. For those new, my name is Brian and I'm a doctor and a sports fan, and it's my goal here to combine those two interests to look at different sports injuries and sports medicine topics to try to teach you all a little bit more about what's going on. Today's going to be a hockey-based video. We're going to take a look at what happened with Vince Dunn and the St. Louis Blues, where he took a puck to the face and has obvious concerns for injuries to the teeth and the bones of the jaw. If you guys like hockey and want to check out other videos, I have covered Connor McDavid's PCL and TJ Oshie's clavicle fracture, so go check out those if you're interested. As always, hit that subscribe button if you want to stay up to date, and let's get started. Now, we of course don't know what Vince Dunn had happened. It could be that there's no fracture or anything there, but we'll talk just in general about what we look for with potential jaw fractures and injuries to the teeth. Going first right off the bat to the actual footage of the injury, there's not that much here to explain other than the fact that Dunn took a really fast moving puck directly to the face. Everything was so fast that we couldn't tell exactly where the puck hit him, but just the fact that he came off the ice with blood coming out of his mouth tells us that there was some injury to the area of the face around the mouth. It looked like everything was spared in terms of his nose and his eyes, so we're gonna focus in the video today about the bones of the jaw and what can happen with the teeth. It seemed like right away he wasn't too stunned, but then we even saw as he was going off the bench that he nearly fell over, implying that he might have even suffered a bit of a concussion here just based on how much impact that puck hit him with. Going here to the anatomy of the facial bones, the big one we're going to talk about is the mandible. And the mandible is your lower jawbone. It's the one that moves whenever you move your mouth to talk, chew, whatever. The upper portion of your jaw is called the maxilla, and that's more firmly in place attached to the rest of the skull. The two articulate at your TMJ, or your temporomandibular joint, and you can feel that on yourself. Just whenever you're talking, moving your mouth, you can feel that articulation of the TMJ up by your ear. If we zoom in a little closer on a side view of the mandible, there are more prone areas to fracture, and in particular, the angle of the mandible seems to be more commonly injured when there is a fracture. The important thing to remember though is there's not just bones here, there's muscle, there's soft tissue, and there's also nerves. The nerves that control sensation to the teeth in the lower portion of the mouth run down through this area on the jaw. Up top, we have the mandibular nerve, and that continues on to form the inferior alveolar nerve that goes down into the mouth to supply sensation to the lower portions of the teeth and the gums. When you go to the dentist and they put that big needle in there and they do a nerve block, that inferior alveolar nerve is the nerve that they're trying to block from transmitting pain. Now they're in the arena, on the ice, whatever, they're gonna be doing some basic evaluation to try to see if they can figure out if there could be a fracture and making sure that everything else is stable in terms of injuries to the face, the throat, and so on. One of the big things they'll do is just see how well he can open his jaw and how well he can bite down to get his teeth from the top and the bottom back in proper place. They're basically checking for any occlusion. Sometimes with a jaw fracture, they can feel a kind of palpable step off or even see some deformities in the teeth based on how that bone might be displaced. There's one specific test actually called the popsicle stick test that you can sometimes do on the arena or at the ice, but basically you take a popsicle stick, have the player bite down on it on one side of the mouth, and then you try to break it. If you're able to break the popsicle stick, that's a pretty reassuring sign that the player probably doesn't have a fracture to the jaw. You do that on both sides, and it's a pretty basic kind of rough and dirty screening test to look for a fracture. Unfortunately, most of the time when you have a mandible fracture, they do require some sort of fixation to heal and repair. If they're really small, really subtle, sometimes you can just have diet restrictions that limit how much you have to work and exert your jaw that can try to heal it up. But the key to healing a fracture is stability. You need to hold those bones really stable so that healthy callus bone can form over top of it and heal that fracture. If it's in your jaw, you're talking, you're chewing, you're moving your mouth all the time, and so it's really hard to keep it stable, and that's why oftentimes these do need some sort of fixation or repair. Sometimes they can do external fixation, where basically they just put plates over the gums or kind of brace things around the teeth, but sometimes if it's more severe, they actually have to go in, cut through the gums, and put some sort of plate down on top of the bone. Just like any other fracture, these take time to heal, usually on the order of weeks, and so we'll have to see what happens in the case of Dunn. If there is a fracture, that'll certainly affect his healing and his playing time going forward. Now, people often wonder what to do if they're playing sports or whatever, and they have a tooth get knocked out. From just the footage here, it certainly wouldn't be unexpected if Dunn had some sort of injury or trauma to his teeth, just because of all the blood we could see, the high impact of the puck. So let's talk about what to do with a tooth getting knocked out. If it's just your baby teeth, there's really nothing to do. Those aren't gonna go back, they're not gonna reattach. But if it's your permanent adult teeth, then there is some potential for the tooth to be salvaged and put back in place and returned in. Now, I know with hockey players, it's kind of a sign of pride or being tough if you don't have teeth or you've had teeth knocked out. So there's probably not too many hockey players that are gonna be rushing to get their teeth put back in, but there's basically this dry time of around 60 minutes where you can try to salvage that tooth. The ideal situation is that you put the tooth back into the socket, have the person bite down on some moist gauze, and then get to a dentist or an oral surgeon as quick as possible. If you can't do that, then you can actually put the tooth in a glass of milk, and that can help give you some time as well to get to that surgeon, get to that dentist to try to put the tooth back in place and hope that it reabsorbs and kind of reattaches over time. The other thing to think of here too is certainly a concussion, and oftentimes we don't think of that unless it's an injury more up at the top of the head, but any sort of impact to the face, to the head, puts you at risk of concussion. And we saw the way that Dunn reacted when he came off the ice, nearly falling over, whether it was pain or he tripped on something or just was disoriented from the injury. Now, as we get more information about Dunn, I'll try to update some of these comments or the description with further information, but I'm a Blues fan, so hopefully this isn't a big serious thing. Hopefully it's just kind of a cut to the gums that caused the bleeding and he'll be able to get back out there on the ice for game 4. Hope you guys learned something here about taking a puck to the face, hockey injuries, broken jaws, what happens if your tooth gets knocked out. Let me know as always, questions, comments below. And until next time, thanks for watching and we'll see you later. Bye.